Dr. Moser. I'm a pediatric palliative care physician, and I'm the medical director of the Shyne Pediatric and Perinatal Palliative Care Team at Blank Children's Hospital. I actually never thought I would do pediatric palliative care. It was a specialty that I didn't have a lot of awareness of, and then through the years of my medical training, I became more and more aware and more impressed with the importance of it. If you had told me even 5 years ago that I was going to be a pediatric palliative care physician, I would have thought that was crazy, but now I can't really imagine doing anything else. Pediatric palliative care is a medical specialty that focuses on children with serious illness and how to reduce the burdens of that disease for them and their families. So palliative care is not only for children at their end of life. Palliative care is not hospice. Palliative care isn't something that takes away hope, or in pediatrics, it's not something where we change goals of care and we don't try all the aggressive treatments that we can. In palliative care, and especially in palliative care in pediatrics, we're just working to make all of those other things easier for a child and their family. So I see patients all over the hospital with all kinds of different diseases and all kinds of different illnesses. So I could spend some time in the NICU with a premature baby who was born at 24, 25, 26 weeks and her mother and talk about things that we need to think about for their care. I could meet patients on the oncology floor after they've been given a diagnosis of cancer and talk about what that looks like for them and how I can help them through their journey. I meet patients in the PICU or the ICU after they've been intubated and it's a big scary moment for them. And I see patients on the general hospital floor who are just kind of having repeated problems and coming in and figuring out ways that we can work together to make their care better. We focus a lot on pain and symptom management, so I have a lot of tricks up my sleeve for how I can make patients more comfortable while they're in the hospital or at home. We work a lot on communication between families and the medical team to make sure that everybody understands what everybody else is saying. I work a lot with care coordination to try and make sure that a lot of the families that I serve, they have multiple specialists, and just trying to make sure all the wheels are turning in the right direction and everybody knows what's going on with everyone else. We do a lot of work with advanced care planning and medical decision making, because a lot of times for the children that I serve, the medical team might give them a couple of different options and it's difficult to know which is the right one for that child and their family. And so I help them through that process of trying to figure out what's the best thing for them to do at that time. Shyne is an acronym. It stands for sharing, healing, inspiring, nurturing, and enduring. And when the team was formed at Blank about 7 years ago, those were 5 key attributes that the foundational members of the team thought were really important that families know that we want to be able to help them with. A lot of the patients that I see have a lot of medical complexity. They have chronic conditions that don't really go away. And so figuring out a way to make life better for that patient and for their families is tough, but it's really rewarding. My wife and I have 3 beautiful girls, so I spend a lot of time reading children's books. I really like home improvement projects. I like working out. I like having goals that I set for myself in terms of working out. I kind of incorporate that into the care that I provide for families too, because I think having goals is very important so that we don't lose sight of the forest for the trees sometimes. These are my girls. My wife Michelle and I have 3 beautiful girls, Lucille, Eleanor, and baby Cora. The Lorax is one of our favorites. Yeah. Can you wave, Lucy? Hi. I'm inspired a lot of times by the families that I take care of. They have incredibly hard jobs and do a phenomenal job of taking care of complexly ill children, of children who have big scary diagnoses, and they just incorporate it into part of their life and are able to make the most of every moment. And I think if I can help them do that better, that's what motivates me.